Okay, hi everyone, it's Lisa from Botanic Skin and Spa. My lovely client here who's volunteered to be a little bit of a guinea pig while I show you some techniques that we use during remedial massage. I wanted to do this because the moment with COVID we're allowed to do remedial massage, we're not allowed to do relaxation massage. So there is a big difference in the two treatments, and people don't always quite understand that. They think that it's more about just how much pressure you're using or that sort of thing. So with remedial, we definitely use particular techniques that help to release trigger points, fascia, break up fascia, create better or encourage better range of motion in the muscle and the associated joints. And of course, there's the added benefits of relaxation, lymphatic movement, that sort of thing. So I just wanted to spend about 10 minutes or so taking you through some of that, and also just emphasize how important these treatments are right now. There's been a lot of talk about whether massage was considered or should have been considered an essential service. I'm not really here to debate that with you today, except to say that I can tell you, after being closed for 5 weeks and getting people back through the door, they have been absolutely pain-ridden without their regular massages. So that tells me that, you know, it may not be, certainly may not be a cure-all, massage in and of itself, but it's definitely a management tool for chronic pain and injury. Would you agree with that, Mandy?
Yes.
So we've had a lot of people, especially with everything going on with COVID, you know, there's a lot of stress, and stress in and of itself puts a lot of strain on the body, not to mention if you have, like my lovely patient here, have a more physical job that involves lifting. Some of you have been maybe busier in some ways the last 6 weeks or so than you were before all this hit. Maybe you're picking up the slack because, you know, some staff have been let off, or you're part of the front line work, or whatever it is, and you're actually doing more than you did before physically. And of course there's the psychological and mental overflow of all that sort of stuff as well. So my opinion is that massage is just such a huge tool for helping us deal with this sort of ongoing pain and psychological pressure that we've been under. And as I said, you know, but going by the number of people who've come in and just been absolutely thrilled to be able to get in for a treatment now. Again, it's been great. So just what I'm doing now is basically just a little bit of myofascial release on Mandy here, and that's to get her warmed up a little, to start breaking up some of the superficial fascia that's holding that muscle in its little netting, so to speak, and keeping it in tension. So we're not really of the belief that no pain, no gain in this clinic. You might find that that's the attitude of certain other places that you go. I believe you can work slowly and deeply and get that nice sort of good pain to get your body to release itself and to work through tension without causing undue or acute pain. So my personal belief is you cannot get the body to relax if you're creating a lot of pain at the same time, if that makes sense, unless it's that good pain that you get from stretching and this sort of massage. So yoga, of course, same. So these are sort of just what we call myofascial release type of movements. You can see I'm just taking my nice broad hand and working away from the spine to try to just start to relax some of these attachment points of the muscles, like the erector spinae and some of the big muscles that attach and move the torso and create a lot of trouble. With Mandy, she has particularly asked me to work on her shoulders and around her rotator cuffs, which are really stuck at the moment. They're really painful. She's been doing a lot of extra work around the warehouse that she works in. So I can feel already that there's a lot of buildup of adhesions around her scapula here. So I'm using my thumbs to get in and do just some initial trigger point. I'm getting the thumbs up over there, so I'm guessing that means it feels good. I'm getting some little bits of crunchiness and some, I can feel that kind of, oh yeah, a little bit of adhesion build up there. Those are trigger point, we're sometimes called trigger points as well. they're often in the belly of the muscle. I'm getting some nice twitching from her here. So again, those are usually the culprits when you're getting like that feeling of the whole muscle or the whole joint just being stuck. It can often come down to just trigger points. Now I'm working over the towel here because I work both this way and with oil. I get nice sort of traction when I don't have oil here, a lot more tension, and again that allows me to really get in and feel the body when I first get started here, and to see where I'm at with the client, how much she's sort of can take today, how she's feeling. So once we do that, I'll start to move into some nice relaxing warm-up type of movements. Now, when I did mention before that the difference between relaxation and remedial is that with relaxation we tend to work more superficially. It is lovely to get a relaxation massage, don't get me wrong, but you'll find that you'll probably get a lot of this sort of nice, long, slow effleurage and petrissage type movements. They have their place even when we're working in remedial because they do help us warm up the body, but they're not the go-to over some of the other techniques that we use for deeper release. So yes, it's lovely to get a nice relaxation massage, but you know, for the most part, it's not really what we need when we have more serious issues that need to be addressed. So I'm just showing you a few of the, this is just so I'm facing the camera so you can see what I'm doing with my hands, but you know, these are just your nice, lovely long strokes. They probably feel quite good, do they, Mandy? Yes. Especially if you got some hot stones happening as well, especially as we come into winter. Definitely a nice type of massage, but I am in a moment going to start working on some trigger points behind her scapula where I was before, so that you can see how that works a little differently. So I'm going to start to come in a little bit deeper here. Yeah, we're getting that beautiful little on the medial border of the scapula here. I'm going to support my thumb here because this is quite, I'm actually putting quite a bit of weight through here, so I will ask you if that's feeling okay.
Yeah, that's fine.
That's okay. We start. Hey.
Ouch.
Ouch, yeah, I got an ouch there. So when I hear an ouch, I usually start to work a little bit more slowly through that point. Sometimes you'll see these shops where they're in with their elbows and they're digging around straight away. That causes more damage than good, trust me, and I've had lots of people come to me and say that they've been quite bruised by that, that they've been really, it's been a lot of pain for them, you know, for the next few days after the massage. Not good. That's not how you should be getting your treatments. There's no need to treat like that. So I found that beautiful little spot on it because I've been massaging a while and I'm pretty good with my elbows. I'm going to actually feel through my elbow here and I can feel where I'm moving. Yeah, and I've just got him. Also, I can see that that's a supreme spot for her. So I'm just going to rest there for a couple of breaths. And we'll just keep moving through that. So now I'm just going to work some long, deep tissue type of movements here with my forearms. So again, these can feel really divine, and also give you that kind of good pain feeling, especially what I'm doing here is working right by her spine. So all these little attachments. Is that okay for you, Mandy?
Yep.
Yeah.
You're right on it.
Yeah, I'm right on it. So I might get a little bit of squirming, so I'll just listen to her body and see what she needs here. And I can, you know, I can feel a lot happening under my arm here, under my elbow. So these are just a couple of techniques. I've shown you a trigger point, and now I'm doing some deep tissue work. I did a little bit of myofascial. There's lots of other things that we do as well, depending on the client and how they present. Now, she did say she's got an issue with her rotator cuff. So at the moment, I'm working in a prone position, but we'll work in what we call supine later on after I've gotten through the entirety of her back here. Now before I want to finish this video, I just want to mention that I almost always will work an entire back and possibly even the back of legs, etc. for every client, because it's all connected. We talk a lot about anatomy trains, and you know, people will often come in and just say, just rub my shoulder for an hour, you know, because that's how it feels. You just need someone to get in and just rub the shoulder for an hour. But it is all connected. It's sort of, you know, if you think about the skeleton and the anatomy of the musculature around the skeletal system, you can see that muscles are layered. They are connected. They're on top of each other. They're next to each other. So there's a lot of joint sharing of you know, sensation and nerves. I'm sure you know, a lot of people say, oh, my shoulders are crazy, killing me, so I've got headaches, you know. So that's referred pain, and that's your body kind of talking to each other throughout. So yeah, I hope you've enjoyed that little demonstration. Some of you might like to try a little bit of this on your partner, but I would not suggest trying to do too much, because obviously it can be, you can cause damage if you don't know what you're doing. You definitely don't want to be going over the spine. But luckily we are open now for a remedial massage, so it's always better to come to the professionals. So thanks for joining me, and I'll see you next time.